Hi, everyone. Welcome to my presentation on should there be any limits to medical tests on humans. Um, to begin, kind of what I'll be talking about today will be human medical experimentation, how it can be unethical, and some examples of that, and why we need regulations set in place. So some background, clinical trials are also known as clinical studies, test potential treatments in human volunteers to see whether they should be approved for wider use in general population. Treatment could be a drug, medical device, or biologic, such as a vaccine, blood product, or gene therapy. Although new may imply better, it's not known whether the potential medical treatment offers a benefit to patients until the clinical research on that treatment is complete. Clinical trials are an integral part of new discovery and development, and they've dated back hundreds of years that go from testing people to little to no information that violated human rights. Although without knowing this experimentation, there's no real way to find the potential effects of new treatments. But with that being said, there needs to be extensive regulations and safeguards put in place for those who are volunteering to test them or have involuntarily tested them. And it's important to recognize how far we've come from that. So the path to modern medicine has certainly been paved by a series of misfortune and people subjected to medical testing without their consent. Some examples include inmates at California's San Quentin State Prison who were subjected to numerous medical procedures, including receiving transplanted testicles from recently executed prisoners. During the research, many men received transplanted sex organs from rams, goats, and boars. And tuberculosis treatments were also tested on prisoners in exchange for clemency, and as well as 400 inmates being exposed to malaria and hoping to find the cure. Just because they were in jail doesn't mean that they were subject to lose their human rights. They still have their human rights. Another very infamous experiment being the Tuskegee trials, which was a 40-year clinical research study in Alabama that nearly 400 of the 600 poor lower level income people that were involved in the trial were told that they had syphilis and were never treated for it. Instead, they were given free healthcare, meals, and burial money as researchers studied how syphilis progressed, and in turn really violated the rules of consent and their human rights, really just to coerce and not give full disclosure to those people. So the reason number one behind limiting experimentation on humans is to protect humans from any harm. The limitations on risks are necessary to protect individuals from facing any significant chance of harm, whether that be temporary injury or illness to permanent ones. And certain limitations need to be set in place for medical trials so that they have some framework to follow, ensuring that not only the institution itself is not at risk of any harm, but as well as the health of any individual volunteering for it, because the purpose of medical experimentation is to improve the lives of the people, not harm it. Um, Secondly, to protect children from unnecessary experimentation, um, a competent adult or rational adult has the capacity to make decisions if they were to want to volunteer for some sort of study, whereas a child cannot. They're both in law and ethics, children are considered vulnerable. So it's not only a moral obligation, but it's a legal obligation to limit the researching of medical experimentation in children. An example of an unnecessary experiment being genetically engineered human growth hormone was injected into healthy short children, and consent was received from these parents, and hoping that they would become taller. It posed significant risk to these children, and it was also linked to having an increased risk in cancer. It was painful, and also didn't really help the children grow in the long term, only really the short term, proving that it was really unnecessary, as it didn't help increase the lives of these children at all. It just tried to fix the stigma of being short. The third reason, testing in economically disadvantaged countries with placebos as a ways to cut corners. In Africa, women who the women were treated with placebos who had HIV, pregnant women specifically, because the cost of the AZT treatment was significantly costly. So they were given, there was a group of controlled people who were given a placebo instead of actual healthcare, which should be seen unethical, regardless of if it's within our country or not, because you're putting innocent lives at risk when they don't even know it, and they're being told otherwise, that they're actually being helped when they're not. Some counter arguments to these. Unfortunately, by the pavement of mistreatment, and it has led to many medical breakthroughs that have helped the world, and it can be seen as without doing these things that we wouldn't have the better understanding of how to get these treatments and surgical techniques and medicines, all things that varied through medical experiments. Another being utilitarianism, which generally is viewed as the morally right action that produces the most good in the eyes of more people. So in terms of medical experiments, the sacrifice of a smaller group of people can be seen as the greater good of people that can be helped. So their lives don't really matter as much if it's helping a greater group of people. And really, in conclusion, I think that many ethical issues in human research have arose in populations that are more vulnerable to abuse. And most of the ethically questionable research conducted in poor countries and people who are of disadvantage are not at capacity to make these decisions. Just generally healthy people need to have more regulations set in place, because without it, we're really hurting instead of helping, when the main objective um, of medical research is to help people. And with the help of these regulations, there'll be a framework for institutions to conduct these experiments safely, and keep everyone safe as well.